Dallas County, as monkeypox cases continue to rise, but there are frustrations when it comes to actually getting vaccines for monkeypox to prohibit it. We want to go out to Fox 4's Peyton Yeager, who joins us live now from Dallas with the latest. Peyton.
Daytona, appointments are limited here in Dallas, and so are vaccines. Dallas County is working to get more shipments in for anyone who had a close contact, but admits that the vaccine won't be widely available for months for anyone who feels they need one. Friday, 100 doses of the monkeypox vaccine were delivered to Dallas County Health and Human Services. The small shipment arrived as the DFW region leads the state in new infections. Of the 183 statewide cases, at least 89 of those are in North Texas, with more than 50 in Dallas County.
We hope to get more, and we're talking to other, I think it's happening nationwide. There's been this difficulty with getting the vaccine, so we're all, anxious to get more.
Dr. Philip Wong, the director of Dallas County Health and Human Services, says simply the supply of doses coming from the federal government is limited. If administered within 4 days of exposure, the monkeypox vaccine can protect someone from getting sick. The county is expecting at least 500 more vaccines by early next week. But even then, only people who have made skin-to-skin contact with someone who tests positive will be eligible first.
It's very unfortunate that we've had such limited vaccine. We're trying to then prioritize it to those that are at the highest risk.
According to the CDC, the current global outbreak of monkeypox is being driven by men having sex with men. That's not the only way the virus is spread, but it is factoring into the vast majority of the new cases, including the ones in North Texas. For the LGBTQIA community, the fear of exposure is real.
The resources out there are not what I think anybody would like right now. We would love to see, more testing, more vaccines, all this sort of stuff. The numbers aren't there right now, and I think that's to a certain extent frustrating.
Raphael McDonald with the Resource Center in the Oak Lawn neighborhood of Dallas says he's seen the demand for vaccines and testing firsthand. But he says all they can do right now is steer people toward county and state health departments.
Right now, we have asked for vaccines from our health partners, and they're just not out there.
According to the CDC, there are more than 2,800 monkeypox cases nationwide. The Biden administration is allocating the vaccine doses it has across the country. In New York, where the outbreak is much larger, enough vaccines were shipped to at least give one dose to half of the at-risk population there. That's not the case in North Texas. And with limited resources, McDonald says the best they can do is ramp up public health messaging.
This is a fluid situation. Vaccine supplies could increase, and I'm hoping that they will increase rapidly over the coming week to 2 weeks. That's the only way that I think we're going to kind of calm this whole situation.
In Daytona, testing is also increasing here in Dallas County. They are expanding to commercial labs as well as hospitals, as well as on the county level. Back to you.
Peyton, couple questions for you for, people who are just starting to get familiar with monkeypox and have a little bit of COVID fatigue. How serious is it? In doing this story today and speaking with so many people, how concerning is it?
Right, the cases have been increasing steadily here in Dallas County as well as North Texas. Now, monkeypox is in the same family as smallpox, according to the CDC. The symptoms are similar. Monkeypox is slightly more mild, and according to the CDC, it's rarely fatal, but those symptoms that you're going to see, rash, fever, fatigue, it's not a respiratory disease, it's passed through close contact, but it should be taken seriously, according to Dr. Wong. He's the head of Dallas County Health and Human Services here, because those cases are increasing and we are still waiting on the vaccines that New York and LA, they are seeing, so we're waiting for our shipment as well.
Right, and your focus today being on the vaccines, who should get it? Everyone should get it?
Dr. Wong said yes, his priority, of course, here in Dallas County is anyone who feels that they need one eventually could get one. For right now, we had about 100 come in today. That's a small shipment. He's hoping to get 500 around Tuesday of next week, and hopefully more and more. So for right now, priority is just people with close contact. We've also heard from other people at the resource center here in Dallas that people are calling them asking for appointments, and right now there are no appointments or very little appointments for even to get a vaccine, that we don't have any. So right now it's just contacting your healthcare provider, asking those questions, getting tested. Dr. Wong confirmed that people are still getting tested here. It's the vaccines that they're still waiting on.
All right, Fox 4's Peyton Yeager, thank you so much for your report out in Dallas, Texas. We'll speak with you soon. And still, there's so many questions about this. We want to give you just a couple of fast facts about monkeypox here. What is it? It's caused by monkeypox virus. Symptoms, like she said, usually include fever, rash, and swollen lymph nodes, and last between 2 to 4 weeks. Severe cases can occur. It's a 3 to 6% fatality ratio. Monkeypox is transmitted to humans through close contact with infected person, animal, or material. As she said right there, a lot of it has been man-on-man contact. Monkeypox virus is also transmitted from one person to another person by close contact with lesions, body fluids, respiratory droplets, and contaminated materials too. We're also getting a different aspect of this story, which is somewhat unfortunate here, as 2 individuals who have gotten monkeypox have been identified as children in the United States. That's according to the CDC as of today. The 2 cases are unrelated and probably the result of household transmission. Once again, this all according to the CDC. One case is a toddler who's a resident of California. The other is an infant who's not a U.S. resident. Public health officials are investigating how both of those children were infected. This is once again a case that we will be tracking here on Live Now from Fox. We want to bring you the latest on all of these issues that we continue to see, not only on monkeypox, but also on polio and on COVID-19, which is what President Biden unfortunately has as well.